Philadelphia wouldn't be an easy effort. There's simply no single solution to this epidemic. That's why we're working to prevent addiction from happening in the first place and working to make it easier for people experiencing addiction to get the help they need to recover. Here in Philadelphia, we believe in giving people many chances, not just one or two. Addiction is a disease that can be treated like any other disease, but for far too long, it has been difficult for people suffering from this disease to get into treatment. Today, I'm excited to announce that major health systems across the city are making groundbreaking commitments to help people suffering from opioid addiction get easier access to medication-assisted treatment. This is one of the many important steps that we are taking together to help Philadelphians struggling with addiction, and these communities will bring us closer to a day when getting treatment for opioid addiction will be as easy as getting treatment for diabetes or high blood pressure. I'd like to now introduce Dr. Farley, who will share more about why this partnership is so important for our city and for its residents, and I thank you all for being here. Dr. Farley.
Good morning. I'm incredibly excited to announce what's really a major step forward in Philadelphia's response to the opioid crisis. Let me explain why. One of the key recommendations of the mayor's task force on opioids was to increase the provision of medication-assisted treatment. That's because this treatment can be life-saving. In fact, if people are treated with a medication, specifically buprenorphine, also called Suboxone, it can reduce the likelihood of an overdose death by up to 50%. So since 2017, the city's been working hard to improve access to treatment with buprenorphine. We've improved that access in specialized drug treatment programs, in the city's jail, in mobile vans in the hardest hit neighborhoods, in the 8 primary care health centers that are run by my department, the Philadelphia Department of Public Health, in other federally qualified health centers and other primary care centers. Despite that, we know that there are thousands of people in Philadelphia with opioid use disorder who are not accessing medication-assisted treatment. In part, that's because although addiction is clearly a disease, the treatment for a long time has been relegated to these specialized drug treatment programs. Now, let me be clear here. We desperately need those specialized drug treatment programs. They're a key part of our overall response. But some people prefer to get treatment through their regular doctor. Unfortunately, today, not enough providers are able to write prescriptions for buprenorphine, for medication-assisted treatment. That's because there's a federal law which says you need to have specialized training and to get a waiver from the Drug Enforcement Administration in order to be able to write buprenorphine prescriptions. As of 2019, there were only 691 medical providers in Philadelphia that had that waiver. Of those, we estimate about 215 were primary care physicians, and that represents less than 20% of the primary care physicians in the city. So if you were to go to your regular doctor, odds are that regular doctor is not able to offer medication-assisted treatment to you. So to get the full access to medication-assisted treatment that we want to in the city, it's essential we have more of our primary care providers to get this training and obtain the waiver. Now, as of the first quarter of 2019, there were about 8,000 people in Philadelphia that were getting treated with buprenorphine. Today, as of this press conference, we are announcing an ambitious target to double that to 16,000 people receiving buprenorphine by the end of 2022. That's the next 3 years. That's shown in this graph over here. That's our goal. To get there, that'll require hundreds more providers to receive the training and obtain the waivers. Our goal is to increase the number of medical providers who have this waiver from the 691 to 1,300 by the end of 22, and of that 1,300, have 1,000 of those be primary care physicians, or primary care providers. That includes nurse practitioners and physician's assistants as well. So what's most exciting today is that the entire medical community of Philadelphia is rising to meet that challenge. Jefferson Health is committing today to get 319 of their employed adult primary care providers trained and have the waiver by the end of 2020. Now that represents in the entire region of Philadelphia. Of that, we estimate more than 100 are in the city of Philadelphia. Similarly, Temple University Health System is going to have all 110 of their primary care physicians, nurse practitioners, and physician's assistants get the training and the waiver by the end of 2020. Einstein Healthcare Network is going to have all 33 of its primary care physicians have the waiver by the end of 2020. And Penn Medicine is going to have 60 primary care physicians waiver by the end of the year. My department, the Philadelphia Department of Public Health, is going to have all 70 of its adult primary care physicians, nurse practitioners, and physician's assistant waived by the end of the year. If you put those all together, that's about 400 primary care providers, so we're going to be nearly halfway to our goal just by the end of this year. These commitments by these major health systems represent a fundamental and needed change in how medical care treats people who are addicted to opioids. In the future, it'll be the norm that if you need treatment for opioid addiction, you can get it from your regular doctor. The actions of these health systems are truly groundbreaking. We are not aware of any other health system in the country that has made a similar commitment to have all of their employed primary care physicians have this training and this waiver. So I can't thank the doctors you're going to hear from in a minute enough for doing this. It is not easy for them to make this commitment, and it's not going to be easy for them to follow through on this. But when the city came to them and said, we need your help to address this crisis, they responded. So today, we are calling on all primary care providers in this city to follow their lead, to get the training, to get the waiver, and make buprenorphine treatment available to your patients. The Philadelphia Department of Public Health can help. We are offering mentorship and expert support to primary care physicians who are newly waivered and need that additional support. As of this summer, we are going to be making available a clinical consultation line for physicians that's available 24/7. If a doctor is treating a patient with buprenorphine and needs advice from an expert physician, you can get that on that clinical consultation line. And we will be sending staff into the offices of 500 physicians in the city to educate them about the waiver and about the city's resources in helping doctors obtain the waiver and prescribe buprenorphine. As the mayor said, getting treatment for opioid addiction should be as easy as getting treatment for diabetes or high blood pressure. We're not there yet, but today's announcement gets us a lot closer. Now, I want to just thank the chief medical officers of these large health systems who are here with us today about their efforts and all that they're putting in to help solve this crisis. I'm going to list them out here now, and then you're going to hear from them in a minute. They include Dr. Ed Probitkin, who is the Executive Vice President of Jefferson Health, Dr. Tony Reed, who is the Chief Medical Officer of Temple University Health, Dr. Rohit Gulati, who's the Chief Medical Officer of Einstein Healthcare Network, and Dr. David Horowitz, who's the Associate Chief Medical Officer of Penn Medicine. We'll hear from each of them in a minute, but first I want to turn it over to Commissioner David Jones of the Department of Behavioral Health and Intellectual Disability Services, whose department has taken many steps to improve medication-assisted treatment already. Commissioner Jones.
Thank you to both certainly the mayor and Dr. Farley for continuing to put the emphasis on combating this opioid epidemic. As Dr. Farley mentioned, medicated-assisted treatment continues to be the gold standard for treating people diagnosed with opioid use disorder, and expanding access to medication-assisted treatment is among certainly the Department of Behavioral Health and Intellectual Disability Services, which I'll refer to as DBHIDS going forward. It's among our highest goals. While DBHIDS does not provide direct service, we oversee a network of over 200 providers ranging from large health systems, represented by some of the physicians that you will hear from shortly, to solo independent practitioners. DBHIDS remains committed to working with our provider network to make buprenorphine available at various levels of care while expanding access to care. In addition to expanding MAT, what we've noted is that approximately 33% of people with opioid use disorder are also experiencing housing insecurity. And so we, as the department, have worked to develop both a residential strategy to complement the MAT strategy. We've increased the number of recovery house beds from 200, that was a case about 2 years ago, to about 500 now. We've increased access to halfway houses as well as other residential housing for people with substance use disorder. And as part of both the halfway house and the substance use disorder, we've included withdrawal management, which allows for the individual to go through detox and then be inducted on medication-assisted treatment. In addition, the Behavioral Health Managed Care Organization, that's part of DBHIDS, that's Community Behavioral Health, is collaborating with the Physical Health Managed Care Organizations to provide coordinated case management to connect individuals with co-occurring conditions to MAT, and then also address their physical health conditions. Along with, as you heard Dr. Farley talk about with the health department, we are going to be working with the physicians in developing that mentoring program to help those newly prescribing physicians. Expanding the number of physicians able to prescribe buprenorphine will make the goal of achieving treatment on demand even more attainable. Currently, there are about 40% of people with opioid use disorder are prescribed buprenorphine. It's probably similar that are prescribed Vivitrol, and about 20% that are on methadone. In order to make treatment even more accessible, what we recognize is that we would benefit from partnering with people with lived experience in order to help individuals then connected to those life-saving treatments. We've trained over 1,000 peer specialists over this past year, including certified recovery specialists and certified peer specialists. We also have peers that are part of our coordinated response to addiction-facilitated treatment. The additional waivered physicians will also increase the efficiency and effectiveness of NET's Access Point, which is a 24-hour, 7-day-a-week assessment center for people with substance use disorders. It's located over at 5th and Spring Garden. We plan to connect both the certified recovery specialist and a certified peer specialist with emergency departments and then also crisis response centers, again, as another way to make sure that people with opioid use disorder are getting connected even more efficiently to medication-assisted treatment. And finally, medication-assisted treatment inductions are occurring through the 38 medication-assisted providers that you heard Dr. Farley mention, to the specialty providers, and that we're also doing a lot of work with adding the work, I should say, with adding the primary care physicians will really make a significant difference, and at the end of the day, we feel like will represent and result in lives saved. So I'll stop there and turn it back over to Dr. Farley.
Thank you. Now I want to introduce with a special thanks Dr. Edmund Probitkin, who's the Executive Vice President for Jefferson Health. This is the large health system here in the city, the one that's made the largest commitment as far as number of primary care providers treatment, and the ones that really we came to first and that first made the commitment. And so I want to give them a special thanks to them that really set the tone. Give him a chance to talk about that.
Thank you very much. Thank you, Mayor Kennedy, Dr. Farley, Mr. Jones, fellow healthcare leaders, and members of the press. Thank you also to our Jefferson CEO, Stephen Klasko, and our Jefferson Health President, Bruce Meyer, for embracing the Commissioner's mission. At Jefferson, we improve lives. And part of that is our commitment to tackle healthcare crises for our hometown. We are proud to be the first health system to answer our city's call and commit to certifying all 319 of our primary care physicians, over 100 in Philadelphia, to become certified to provide Suboxone treatment by the end of the calendar year. But we recognize the need to do more. In 2018, we changed every opioid prescribing preset in our Epic electronic health record to 3 days, 10 tablets. And that has resulted in thousands fewer prescriptions written by our physicians each year that could potentially put folks at risk for opioid addiction. We have mandated e-prescribing, And we have instituted a data mining system that actually examines the prescribing patterns for every single Jefferson physician every day so that we can tell if there are problems with the prescribing process. And excluding tramadol, the result of this is that no emergency department physician at Jefferson over the last year has written more than 15 individual narcotic prescriptions. And through all of these advances, we have shared these results and these learnings with folks across the country. But change begins locally. And truthfully, our award-winning MATER program, our maternal treatment and research program, partnering with My Sister's Place, helps to take care of those pregnant women that face opioid addiction, and also helps to take care of their children with long-term and short-term residential housing. And our neonatal intensive care units, partnering with those across the city, also help to treat those infants that are afflicted with opioid addiction. Our emergency rooms partner with the EMTs, with police, with primary care providers and the treatment centers to safely treat the people that come to the ER facing the acute problems with addiction, and then hand them off to rehabilitation centers to also help with the long-term problems with addiction. And our support for our underserved communities, really those that are hardest hit by this scourge, is reflected in our support for the Philadelphia Collaborative for Health Equity. I would urge all of you to take a moment to look outside to the photo voice display. That is really put together through PICHA, through the Philadelphia Collaborative for Health Equity, and it was put together by 33 of our teenage students, really illustrating the problems that they face in health in their northern Philadelphia communities. Finally, let me end by recognizing the many families and communities who shoulder the burden of this opioid crisis. All of us as health system leaders truly admire the love that you bring to this struggle, and we pledge to do our best and join our city leaders in doing their best to lessen this opioid crisis. Thank you.
Thank you very much. The opioid crisis has affected the entire city of Philadelphia, but no area has been hit harder than the area around Temple University Hospital. So we're especially pleased to have Dr. Tony Reed here from Temple University Hospital talk about their commitment to have their primary care providers get this training.
For those who know me, you know I really am not a big fan of standing in front of a crowd of people. I want to start by thanking Dr. Farley for getting us all together and thanking the mayor for the opportunity here. And really, to me, this is one of the most important things that we do for our community. As Dr. Farley said, we have a hospital in Kensington. It's where our behavioral health unit is. It's where we have an emergency department. It is where we treat this every single day. North Broad is not much better from that. And so long before we talked about primary care docs, we talked about how to get our hospital ready for this because we saw it coming. And so we already have most every hospitalist and are starting our way through the specialists ex-waivered. We're now beginning the process in our primary care groups beyond our hub and spoke. And so many of you know that we have a hub funded through PACMAT money with spokes that will increase to a total of 20 over the next year, giving us better opportunity in our ambulatory environments to take greater care of our patients. This, while we're actively engaged in the handoff process from our emergency department to our practices, from our emergency department to the single county authority, and from our emergency department to the floors. Much like what Dr. Probitkin said, we've all done everything in EPIC we can to control the prescribing, to control the front end, the primary prevention. We still need to do more in the community to prevent the influx from other communities, but that's something we'll tackle at a different time. Our commitment in this is to continue our training in the X-Wavering program and the buprenorphine program, and to train our medical students in that program, because they brought it to us and said they would like to be trained. Through our partnership with the university, both in the education and in the training aspect, we also are engaged in research on modifying, adapting, and improving upon best practices, both in the treatment side and in the prevention side. And so I just want to conclude by thanking all of you for showing up today and having an interest, for thanking our families who bear with us through this time of need, and for thanking everyone else here in the group who has shown such a strong commitment to the citizens of Philadelphia. Thank you.
Thank you. And not far from Temple University, we have Einstein Healthcare Network, where the Chief Medical Officer, Dr. Rohit Gulati, himself has the training, has the waiver, and prescribes buprenorphine for his patients. Dr. Gulati.
Good morning, everyone. Thank you for having us here for this really important discussion, and thanks to the Mayor's Office and the Health Commissioner for doing this. I come from Baltimore, and having done this around, a few places, this is the first city that I know of, and Tom, you can correct me if I'm wrong on this, that the entire city, led by the Mayor's Office, the Health Commissioner, and the academic medical centers and hospitals, is coming together to provide and commit to treating narcotic overuse disorder in the way we're doing by committing to primary care physicians to the extent that we're committing to. So I think this is a monumental decision a city like Philadelphia, the 10th biggest city, can show towards the rest of the country how it can be done and how corrections can be done. So I really applaud the Mayor's Office, the academic institutions, the primary care centers, the federally qualified health centers, and the Commissioner for taking this on and leading charge in the right direction. On the other hand, I also want to say thank you to the people at Philadelphia who've led this and helped make this happen. We have Dr. David Greenspan here from the Department of Psychiatry, who's the chair of the department, along with Maureen and Rebecca, who've led the charge at Einstein to commit to having all the primary care physicians at Einstein X-Waiver trained by May of this year. So by May of 2020, we've committed to having every single primary care physician in the city of Philadelphia X-Waiver trained so they can help with this epidemic. As a physician myself who prescribes Suboxone, it's one of the most grateful or fruitful endeavors a physician can do. Many of my patients were able to lead productive, normal lives after getting Suboxone. It is a drug that can treat not only the patient, their families, the community, and the amount that we need to treat is extraordinary, and that's why the entire community is here to treat it. So I think this is a monumental decision going forward. Thank you for doing this, and look forward to helping the cause. So Einstein's behind this. And lastly, just a word from our CEO, Barry Friedman. He stands behind treating substance abuse, narcotic use disorder that's plagued our community, and will join hands with all the other academic institutions to treat this. Thank you so much.
Thank you. One of the strong partners from the beginning of this crisis has been Penn Medicine at the University of Pennsylvania. To talk about the work that they have done and will be doing, Dr. David Horowitz, who's the Associate Chief Medical Officer.
So like many of the other folks standing in front of you today, I'm a clinician. I'm also an administrator, but at heart, I'm a clinician. I'll start with a patient story. It's about 1.5 years ago, and I'm helping to run the teaching service in one of our West Philadelphia hospitals. and we admit this young woman who has a particular medical complaint, and we do our best to interact with her and to give her a metaphorical hug around her care, and she's very resistant, and she's withdrawing from opioid. And we are able, in those first few days, to start her on this, what I'll call a wonder drug, buprenorphine. And within a few days, she becomes the person that she probably was before she developed her addiction. She's interactive, she's pleasant, she's disclosing about the struggles in her life, and she is apologetic for her prior behavior, but also grateful for the new friendship she's developed with us. So I think we talk about theory, but when you see these medications in combination with therapy work for patients, that's when we become truly passionate. So I'd like to thank the mayor, I'd like to thank the health commissioner for having Penn here today. I'd also especially like to thank my colleagues at the other health systems. You know, we live in unreasonably divisive times. It is especially gratifying for me to be here to discuss a topic around which we can all galvanize and unify and have very much the same opinion of what we should be doing. So thank you very much. We all know, or many of us know, that over 1,000 lives were lost in the city of Philadelphia within the last year from overdoses. At Penn, as there have been at other health systems, we've been working at least for the last 5 years to deal with this devastating crisis. So 2016, we created an internal task force to collaborate with the city's task force and with the state task force. And we've done a lot of the same things that you've heard the other CMOs say. We've done data mining, we've created pathways, we've limited opioid prescribing electronically, we've done our best to outreach to the community. In the last 2 academic or financial years at Penn, we've had roughly over a 30% reduction in opioid prescribing, and I think that is still the tip of the iceberg. For patients suffering from an overdose, we know that offering immediate treatment with buprenorphine helps to stave off withdrawal symptoms, and warm handoffs to certified recovery specialists help connect patients with support services and navigate their journey to recovery. We started in our emergency departments, but we're continuously looking for new and creative ways to improve and expand our efforts. Today, all of Penn Medicine's emergency medicine providers and family providers in our Philadelphia hospitals have taken the 8-hour X-waiver training to offer medication-assisted treatment. We're going to accelerate our efforts and offer even more evidence-based treatments and expand a culture of destigmatization in caring for patients with these chronic medical conditions, no different than the management of diabetes or hypertension. To that end, we are committed to having all of our primary care physicians in our Philadelphia practices complete the X-waiver training. We all have the power to save life. To continue making progress, healthcare providers need to band together. Today is an evidence that not only within Penn's health system, but across the city, we are banding together. Patients with substance use disorder need to be able to rely on all providers, from emergency department to the doctor's office to the advanced practice providers, for help. We have momentum, and that gives me hope, but we can't stop. We are very encouraged by Dr. Farley's dedication to this devastating issue, and we look forward to making an even stronger impact together. Thank you.
All right. Again, I just want to thank all the health systems for rising to this challenge. If you put the numbers together, it's approximately 400 primary care physicians just in the city of Philadelphia will get this training based on the commitments today, and over 600 across the region when you count those outside the region. So it's a huge commitment. So thanks very much for coming, and I want to just make anyone available for any questions that anyone has. Right. Some people will be on this medication for months, some people for years, some people lifelong, and certainly you can function perfectly normally on this medication. So it depends on the patient how long they'll stay on it. Right, could be a pill a day. Other questions? All right, yes? So the training, it's 8 hours of training, and it's about opioids, and it's about buprenorphine specifically and how that functions, how patients, you know, the different ways to use the medication to treat patients. That you have to give it at the right time in the cycle of withdrawal, and there's certain dosing to maintain people on it. And then as far as how physicians would use it, really it's going to be dependent on the patients. Patients will come to their attention who have addiction, and they'll say, well, you're interested in this treatment. So a lot of that training is the specifics and tailoring it to the specifics of an individual patient. Because a number of physicians, this is new for them, that is why we do have the expert consultation and the consultation line. So that if questions come up about specific patients, for example, if someone has addicted to more than one drug at a time, they want some help with that, they can get that help. All right, thank you very much for coming, and people are here individually available if you have questions for them individually. Thanks very much.